of an IUGR baby?
Coming to the taking care point of an IUGR baby, first of all, I'll tell you, after the birth of the IUGR baby, what happens, okay? So if the baby is born after IUGR baby, if it is born, it cries immediately after delivery. Most of the babies don't have a delayed cry. Most of the babies will cry immediately after delivery. And most of the babies doesn't need NICU admission. The baby will be mostly active, like around 1.8 kg. Below 1.8, babies only will do admit. Above 1.8 kg of the weight of the baby, generally we won't suggest an NICU admission because it needs a proper feeding. If you don't feed that baby, the sugar levels immediately drop down. Compared to preterm babies, the sugar levels in IUGR babies will not maintain immediately. These babies, small babies, stomach capacity is very small, so they need rapid feeding every hourly. A small feed, but every hourly feeding baby is needed. If you don't give a proper feed such a babies, the sugar levels will drop down. It is called hypoglycemia. So in babies, if hypoglycemia is recurrent, that babies will throw seizure, and seizure will cause a brain insult. That is a permanent damage. So this is the most common problem in IUGR babies. First thing, the problem is hypoglycemia. And second thing is metabolic problems like magnesium, calcium, all the elements will be low in such babies because the body proportion is low anyway. So the amount of the cell count is low. So all metabolic problems will happen in IUGR compared to preterm babies. So you have to take a proper feeding for such baby. IUGR babies, if you give a proper feed, every hourly feed, proper feed if you give, baby will grow faster and baby will cry. Not even stay 1.5 hour, baby starts crying. Okay, that is the problem. And in babies, jaundice percentage will be less. Compared to preterm babies, these babies jaundice percentage will be less, but you have to see in a little amount, like neonatal jaundice, you all know. So if you count a little bit amount of jaundice, better to go for a phototherapy. Don't go for a home treatment because it will take a longer time to come down of that jaundice. Okay, this is the immediate outcome after delivery for the first 1 week. Anyway, after 1 week, most of the mothers will get the feed. So in such babies, mother feeding is better compared to top feeds because preterm babies, most of the mothers will not get feed because it is preterm. So most of the mothers will not get feed. Such babies, top feed is okay. In IUGR babies, most of the mothers will get feeding. So mother feeding in such babies, if you give, they will get proper amount of immunity, proper amount of nutrition. So such babies grow faster. Okay, immediate taking care of the IUGR baby. So as the baby grows, definitely you have to give a vitamin supplementation. You have to give multivitamin and vitamin D3 and calcium. Proper vitamins has to be given in such babies because these babies are IUGR. Body proportion is low. Extra calories, extra vitamins has to be given through as a medicine. Okay, mixed thing. Most likely babies nutritional supplementation if you give, babies definitely grow up properly, and immunity will be low in such babies. So you have to take care not to get a cross infections. Better not to roam this baby outside. You have to take a proper care, proper nutrition, and mother has to take a proper diet. Definitely you should see that mother should get a better lactation, and she has to take proper medication also in IUGR babies. And I told you, hypoplastic babies, if you have any hypoplastic baby, the head circumference has to be recorded. Every month you have to go for a checkup. If the baby head growth is not developing properly, suppose in hypoplastic babies, those babies will have, some babies will have a delayed cry. You will know anyway, your gynecologist will taking care of you. So if you have a delayed cry, they will suggest you a CT brain or NSG, whatever. Depending on that, you have to take a proper care in hypoplastic babies because brain development cannot be predictable in such babies. CT brain has to be done in such babies, or if possible, MRI brain also has to be done. Mental development has to be taken care because there is no other medicine for the brain development. Inside the uterus only brain has to develop. By the after birth, if the brain size is low, mostly we can't do anything except additional DHA will give. Other than that, we can't do anything. Okay.